I just want to say thank you for everyone attending today. We have some heavy hitters in our community, and I'm so excited to have our first talk about rural health and the coronavirus, also known as COVID-19. So our first person today is Pastor O'Ree. Can you please introduce yourself?
My name is Michael O'Ree. I'm the pastor of Christ Way Ministries of Bogalusa, Louisiana, and I'm just excited to be a part of this discussion on today.
Okay, thank you for joining. And we have Miss Taffy.
Hi, I'm so glad to be a part of this today. My name is Taffy Morrison. I work with Louisiana Department of Health, Wellhead, Louisiana. I am the Healthy Community Coach for the Bogalusa Mayor's Wellness Council and Bogalusa Strong Healthy Community Coalition. So glad to be part of this today.
We have Dr. I and Dr. Maris.
Hey there, I'm Dr. Maris. I'm a family medicine resident at Our Lady of the Angels and very happy to be here, part of things today.
And I'm Dr. Yamu. I'm also a family medicine resident along with Dr. Maris, and it's nice to be here also.
Okay, and we also have Councilwoman Miss Danielle Keys.
Glad to be a part of the talk today. Danielle Keys, councilperson for District B, City of Bogalusa.
Okay, so we're going to go ahead and get started. We will not be long-winded, but we do plan on giving you some awesome information today. So COVID-19 has definitely affected many communities. We oftentimes see in the news people talk about the urban communities and sometimes the suburban communities, but a community that is being silently hit by the coronavirus is rural communities. And one of the biggest issues is sometimes our lack of access to relevant and current news. In addition, we sometimes don't have access to the specialty services, and sometimes people cannot social distance for whatever reason. I want to start off with Miss Danielle, and I want you to just talk about any changes that you've seen in the community secondary to COVID-19.
Okay. The noted changes that I've seen in the community, of course, everyone has changed their normal routine due to the social distancing orders, as well as just the precautions that COVID-19, can bring about. I will say that this pandemic has definitely brought the community together, looking out for the elders, looking out for those who may not be in a great situation. The pandemic has definitely brought out some of the good, in our community, despite, the horrors that this pandemic has brought upon our people.
Thank you for that. What about you, Miss Taffy? Have you noticed anything different in particular, especially in rural communities?
I will say the same thing that Danielle said. We've seen a lot of pull together of partners. We've seen community members helping others out, helping the elderly, reaching out to the elderly, great partnerships. But what I've enjoyed seeing is technology increase. We're having to definitely depend more on technology in the rural community to be able to see our church, to talk to our church. Pastor O'Ree has a wonderful post on Facebook regularly on Wednesdays and Sundays. So we've been challenged to move forward with technology, which is going to be a great thing for the future because we're going to be able to connect with each other in more innovative ways. I think I've also seen a lot more family bonding. We're spending a lot more time together as a family, and we're looking and reflecting on how do we spend our free time outside of work, and how can we make it more caring for others, but also uniting with our families more and bonding together with our children in a different way. I think I've seen that a lot. So I've been seeing the improvement in families and in community members and also bringing people together in different ways. So I think it's been very positive in that way.
How is practicing medicine right now at Our Lady of the Angels? And also, what are some of the changes that you guys have had to make to serve our patient population?
As far as practicing medicine, we are going to completely telemedicine, at least mostly telemedicine at this point, meaning we have telephone visits and video visits for our patients right now. As far as the telephone visits, it's a little bit more complicated, or at least complex, with face-to-face interactions. I know I personally help my patients with going through their medications and, telling them, this is why this was prescribed and this is why you're taking this medication, so they have an understanding of what they're doing. Also help them try to, just reconcile their medication, make sure they're taking the right ones. Over the phone, it's a little bit hard. A lot of my patients are older and they have vision issues, and so it's been a little bit difficult to try to make sure that they have the right medication, that they're taking them the way they're supposed to, and that's been a barrier. On the plus side, I think patients are more relaxed over the phone. Most of the time they're in their car or their home and they're comfortable, and they tend to open up more about things that they wouldn't when you're, looking them face to face. And, I've actually made some deeper relationships with my patients. And I think this is something that was mentioned in a conversation before, but, we do have a lot more patients who are calling in. It's been a big surprise. They despite not being able to come in, they know the importance of, following up with their primary care doctor and getting refills. And that's been rewarding to see. As far as the hospital changes, I think Dr. Maris can speak a little bit about that.
Yeah, so on the hospital side of things, we've been adapting to make it a very safe place, despite taking care of folks with this infection process. So we have new screening points at entry to the hospital. So that goes for staff and patients alike. Everybody's getting screened with their temperatures taken. And then inside of the hospital, we've been changing kind of the movement of personnel to keep the patients and personnel responsible for COVID in certain areas. So that goes for the emergency room that's kind of concentrated in one area to prevent it from going into the other areas. And then there's also new floors that have opened up that are dedicated specifically to COVID with the appropriate technology. So negative pressure rooms, and is kind of a primary way to keep those floors safe and keep the rest of the hospital safe for people who don't have COVID. So we've been definitely seeing a lot of adaptation, making a lot of changes, and having some good success with it.
So that also brings me to our church community. Pastor O'Ree, you see in the hospital setting, people have had to get creative. They've had to use telemedicine, which is great in some ways, not so great in others. How have you been able to reach out to your church members during these times and still provide a sense of community despite not being able to have in-person sermons?
Well, in 2013, we started our conference call line, and we've utilized that line since 2013. Therefore, we've already kind of been acclimated to telephones and telephone conference calls, and also to social media. We go live for Facebook. We've been doing it for the past 4 years. So it hadn't been a real big adjustment for us. We just had to step our game up a little bit better. So we're doing Zoom now. We're doing the Microsoft team now. And we're utilizing all the technology we can get our hands on for some of these smaller meetings we would normally have at the church. And so it's been a great adjustment for us.
Okay, I love the fact that you're incorporating telemedicine. It's the best way to keep your church members safe. Do you still feel very connected to your church members, and are you able to get a bigger sense of what's going on with them in their homes because they're more relaxed and comfortable?
Yes, ma'am. I'm gonna say for the most part, I'm a hands-on pastor, so I know most of our members personally. I took communion to all of them this past week. Our communion Sunday, second Sunday, so I personally took it to all their homes and dropped it off to them and had a chance to chat with them through the door or whatever the case may be. So I take a hands-on approach with my members, and I talk to them at least once a week, check in with them if they need something, especially some of my older members. We check and see if they need something. We do. We have men who are able to go out and get what our elderly members need and deliver it to them.
Do you think that the way that you, I guess you preach the gospel is going to evolve from this situation in any kind of way?
Yes and no. And the reason I say yes, for some people, their faith will increase during this season. And for some people, it will decrease in this season because there is a silent group of people who believe that God is the cause for this, and why would a loving, caring God cause my grandmother, my uncle, my dad to die and cause my family to go through so many changes? So for the most part, some people's faith will increase, and there are a few people faith who will decrease during this season because they won't trust in God in the midst of this situation we're in.
Thank you. think we all can agree that we don't need to go back just to the old way things used to be. We've heard some of the wonderful things that our pastor is doing, and innovative, I'll say, dropping off communion to everyone. Miss Happy, can you tell us also about some of the available resources for community members who may need a little extra help, and also for small businesses who may need a safety net or who do not know how to pick up from here?
Sure. But I want to follow up something with Pastor O'Ree. We've been able to do through Bogalusa Strong and the Bogalusa Mayor's Wellness Council is we have reached out to all the pastors in the community and in Washington Parish. We've had up to 50, 60 pastors on a conference call to be able to link them to the resources that I'm going to discuss, but also to Louisiana Department of Health resources. And we bonded a wonderful relationship with the pastors to be able to reach out in a different way. And they've so embraced that and appreciated that. And they're utilizing that information to help their congregation and the members get to the resources, but also link to what the current education is for COVID-19. So I'm very grateful for the pastors. And that's a new bond that's being created for us with the pastors and the ministers. So we're very grateful to see that. And grateful to have that partnership. But there's lots of resources that citizens oftentimes in the city of Bogalusa and Washington Parish, they say, oh, we don't have anything here to help us. We lack resources. Well, that's not necessarily true. There's a lot of resources that are available, but a lot of times we don't know where to access those resources, where to get those resources. So what has been created through all of this is on the City of Bogalusa website. The mayor has done a couple of things. Is one, she has a regular radio show now every day at 12 o'clock with the physicians of Our Lady of Angels Hospital, with the medical professionals, with economic development. Today we had Warren Montgomery on from the district attorney's office. So we're bringing a lot of resources to the people, especially elderly, through the radio program. So that's something new that we haven't been doing before. And I think it would probably continue after this, but we've been able to give those resources out in a different way. The other thing that's been created is on the City of Bogalusa website and also the Washington Parish Alert website, we have put a 12-page community resource guide that's available that we update every day almost. And it can be accessed by all community members to know everything COVID. But also on that same website, there's also community resources that have now been put on there for other things outside of COVID-19. So we've been able to link that, and all the resources I mentioned are going to be there. So one of the things we are asking people to link to is, if you're on Facebook, if you're on social media, go to Louisiana Department of Health website, go to the local hospital websites or Facebook pages, both. Go to CDC and like them as a Facebook. Go to the governor's Facebook page. Go to the White House Facebook page. Stay in communication and say the current knowledge. Don't listen to the rumors of what other people know. Go to the facts. Go to the resources and know what is available. There's other resources that are also available. We've connected with our United Way. They have alert pages, but they also have a financial assistance page now where they have 15 minutes of fame on their Facebook page where they're helping get through crisis budgeting. How do you spend your stimulus check? That's available, and you can get a lot of tips with that. There's also available for SNAP funding. A lot of people now are finding that they're unemployed and are unable to afford food right now. So you can get SNAP benefits, and you can be a new application for that. And that's been available in our state. And you basically just, text LA COVID to 67283, and you can be a part of that. That's for the emergency alert. And then for the SNAP, you would also do 898-211, get SNAP. And you can be available, you can get that as well. We've also, and then the CARES Act is also providing extra meals for seniors. And so you can, contact your local council on aging. Ours is Washington Parish Council on Aging, and get on a list, and you can have meals delivered straight to your home for the elderly. So that's been available. Those are new resources. There's also unemployment resources that are available, and that's through our Louisiana Works. And so you can just Google Louisiana Works. We also found out through the Economic Development Director in Washington Parish that there's a lot of jobs available. And you can get that through going to NOLA, Work NOLA. and you can go there, and there's lots of jobs that are available. You may not be able to do the same jobs you did before, but there's something you can be doing during COVID-19. So that's also been very helpful. So, and then we did find out today for businesses, there's a new grant out there that from the Chamber of Commerce, U.S. Chamber of Commerce has a small business grant. So does SBA, has a lot of grants through that as well. So, and then you can look on the Washington Parish Economic Development page, and they've got all the grants listed for every business. So there are a lot of resources and funding out there to help us. We just got to reach out for it. You know, and we know where the resources are. And again, those can be found in a one-stop place. You can go to the city's website, you can go to the parish website. There's a 12-page resource guide and a one-stop. All those resources are right there for anything you need as an individual, as a family, as a senior, as a veteran, as a business, as a nonprofit. All of those resources are all connected together. So there's a bunch of resources. We just got to know where to get them.
Thank you very much for that. That was very helpful. I think I'm going to even look at that page for my own business. I have a question for Ms. Danielle Key. So we talked about resources. I think what's important when we have resources is also to know what our community need. How are you still able to stay connected with the community during this pandemic?
Not only myself as a council person, most of my fellow council members, we have Facebook pages. And so we do welcome our constituents to, you know, any concerns or needs that they may have or questions to reach out to us through that Facebook page. But also we've been very reluctant to get our information out with our personal cell numbers. So if they need us, you know, we're available, you know, for them to call and voice any concerns that they may have.
Thank you. So something that's also important right now is counseling. This is a question for everyone, but we're going to start with our physicians first. Right now, pre-existing conditions put people at a chance of having worse outcomes if they do get the coronavirus. And so when we talk about pre-existing conditions, we talk about obesity, high blood pressure, COPD, asthma, high cholesterol, diabetes. How can we move forward, and how can we counsel our community about making better choices?
I think, you know, what I'm doing with my patients personally with the telemedicine visits, you know, I am, you know, as we're going through all these changes, people are staying at home, people have limited access to healthy foods, to fresh fruits and vegetables. A lot of people are eating canned foods or carbohydrates. And one thing I'm counseling my patients is to take this opportunity to really kind of look and analyze, you know, what am I eating? What am I doing? You know, usually, you know, when people are at work, they're like, oh, I'm too busy to exercise. I'm too busy to, you know, eat healthy or go to the grocery store and buy this. But now that we have this time, it's a time to kind of look and look at your life, you know, the way it is right now in this COVID pandemic environment and think, you know, what changes can I make, you know, day by day, you know, instead of drinking this Coca-Cola, can I drink a bottle of water with maybe some lemon in it? Or, I'm home all day. Can I walk around my house or, you know, do some exercises outside in the yard or my living room, things like that. And with people with chronic conditions, you know, it's very easy to, you know, kind of get into the habit of, you know, eating what's available. But for diabetics, you know, this is not a good time to eat the easily available carbohydrates, especially, you know, when there's kind of restrictions from going to the hospitals with, you know, with hyperglycemia or high blood sugar. And so, you know, even more so now I'm pushing, you know, healthy lifestyle habits to people with high blood pressure and diabetes, you know, decreasing salt, staying away from the canned foods. And I think that's really hard for a lot of people right now. And I think that's very understandable. And so I think just trying to figure out small ways to make those changes and to stay safe at home. I'm encouraging my patients to call in ahead of time for medication refills and not wait until they run out. All these different kind of tactics to keep people out of the hospital, keep people healthy, keep people doing well at home.
And I think another thing that I would add in to emphasize exactly what Dr. I is saying, but also something else that's unique about this particular scenario is that everyone is stuck at home. And so to reach out to community members, to friends, family, and say, hey, you know, now that you have time too, what kinds of things are you thinking about for your diet, or what kinds of things are you thinking about exercise, and kind of opening up that conversation so that it's a conversation that's had between physician and patient, but also among family members, friends, and everybody can start kind of talking about how we can use that time to their benefit.
Do you see better or worse outcomes as far as high blood pressure, diabetes, high cholesterol? Do you see people taking this time for self-care, or do you think that the stress is going to cause some people to still continue to make unhealthy choices or not even have the healthy choices to make?
I think initially when the social, when the quarantine went into effect, I think initially I saw a little bit of an uprise in, people having high blood sugar and, the uncontrolled high blood pressure. But I think surprisingly, I have, my patients now telling me all the new things they're doing. I had a patient tell me, oh, I'm walking to the mailbox back and forth, and that's how I'm getting my exercise in, and so I think it's a kind of mix. I think some people are falling into that trap of, well, other people are at home right now eating junk food, so let me go do the same, versus other people are thinking, you know what, I can't go to the hospital. The hospital's not a safe environment for me. So what can I do to stay healthy? I'm trying to advise people to be in the latter group and to, try to do what they can. But I think a few people, are still struggling with figuring out how to manage their chronic conditions at home. I try to encourage people to call in as much as possible to the clinic. There's no such thing as too many doctor's appointments, and I think there's a lot of other providers. I know Dr. Harvey, you're also helping people that don't have the funds to have an encounter with the provider and, for refills and for healthcare. And so I think that, there are options, there are people out there to help. I think just encouraging people to come in and call, get refills, come in if they have questions. If they need advice about how to eat healthy, call, we'll help you out any way we can.
Also, a lot of people are afraid right now, and rightfully so, because of the coronavirus. Like, they automatically think if they get it, they're going to die. Can you tell us, is that true? Like, we know that it's not true, but can you just be, a voice of reason and a voice of comfort for those who think that this is an automatic death sentence?
So most people that get coronavirus live. They survive. It's actually a small percent that die. The reason why there's such an uproar about this virus is because, in comparison to other viruses, it's spreading so easily, and there is a higher death rate, meaning the percentage of people who die is higher than suspected. That still means that most people do well. In communities where there's a lot of high blood pressure, diabetes, lung issues, COPD, asthma, these communities are more at risk for having more people get seriously ill. And so that's why we're kind of encouraging people to stay at home, to try to avoid getting the virus. But most people do live. The reason why it's so crucial that we take the virus seriously is because most people is still not everybody, unfortunately. And, I talked to a friend in New Orleans the other day, and, she had her first encounter with someone she knew dying from it. I had someone I knew pass away from it. And so it only takes one person that's close to you to have this hit home. And so, yes, most people survive, but we also have to protect our most vulnerable neighbors and friends and family members.
Do you feel that we're testing enough here in Bogalusa? I know that the hospital, and I'm so proud of the hospital for doing this, is actually having drive-through testing. You just need to see one of the physicians there. You guys via telemedicine, which is easy and quick. And I do hope that you guys, I don't know, I'm asking, if someone can't use telemedicine, can they use their phone to do a telephone visit with you guys instead and still be able to generate an order from that?
Right. So the way that's kind of working right now is we can do a telephone visit with the person and kind of just assess over the phone. But a lot of times, if someone is having some pretty serious symptoms, we need that physical exam to be able to listen to their heart, listen to their lungs. So we actually just started a drive-through respiratory clinic. So what we do, what we do is we kind of talk over the phone and assess kind of, okay, what are your symptoms, where they start, those sorts of things. And then if we feel it's necessary to listen to the lungs, listen to the heart, we coordinate among nursing staff and the physicians and get them in usually the same day, that afternoon, to be able to, the patient can drive up, have a physician come out, talk with them, listen to their heart and lungs, and then that physician will determine if they require testing for coronavirus or otherwise, other examinations that may be required. So it starts with contacting primary care doctor, getting set up with a telephone visit, and then if that doctor feels it's necessary, getting in with the respiratory clinic where they do a drive-through assessment, potentially testing from there.
Okay, so do you see what Our Lady of the Angels is doing, you guys? Like, we're way ahead of some other rural communities, and I'm really proud of the hospital and its response to the coronavirus. I know you guys have PPE, you guys have counseling for patients. Okay, so we're just going to have the mayor at a later time. So we're about to wrap up. I think it's important some of the I know it's important some of the things that you guys have said as far as the initiatives from the hospital trying to maintain health. I think Ms. Taffy can also talk about some of the community outreach that we have to keep people active and help people make good, healthy eating choices.
Yeah, I think some of the positive effects from the COVID-19 in our community is just going to be, more awareness and inspire us to improve our health. We understand that the underlying conditions are diabetes, obesity, all the things that are sometimes lifestyle oriented, heart disease, high blood pressure. It's sometimes what we do every day. So we're with us at Louisiana Department of Health. We want to hope this inspires people to improve their health. Let's start today by lowering that so we don't have those underlying conditions. That we can improve that. And I think that's what we can just think about every day, reflect on what are you eating every day? What are you doing every day? That's going to affect the long term. So we're hoping this will inspire healthy eating habits, improve more physical activity. The parks, we have parks in the city of Bogalusa, and one of us is a walking park, Goodyear Park in front of the hospital. It's still open, and it has a lot of walking paths that you can do. We're actually spending some money and grant money on to improve that, to have outdoor exercise equipment. We were supposed to have that, unfortunately, in April. It was going to kick off and open, but unfortunately it hadn't been able to do that. But we are bringing resources, and resources are there that you can actually have to get active. And so that's part of it. The other things I think we need to make sure is we question our family culture. Is our family culture a healthy culture? It may be something, well, this is what we've always done. This is how my family works. But is that creating health in your community or in your family? Is it creating healthy children their future doesn't look like diabetes and obesity? So I think we need to question every day what we put in our mouths every day and get educated. That's hoping that something that we are going to be able to provide and continually provide is a lot of nutrition education classes that are being provided. We're wanting to put more online right now in social media. We're working on that right now. But there's a lot of resources through LSU Ag, to the hospital, through Louisiana Department of Health well ahead, that we can start giving ideas. Now you're home cooking. So now that you're home cooking, let's start making some healthier choices and make the healthy choice the easy choice. So let's look up recipes that maybe are a little lower in fat, lower in carbohydrates, lower in salt, that even though we may not have the conditions yet, let's make it where we don't have those underlying conditions. So making those small changes, it doesn't have to be drastic. Make a small change, substitute a food out, walk to the mailbox, like what Dr. I said, or walk down the street and back. If we start making those small changes, it's going to make long-term changes. And it's going to make long-term changes as we continue to deal with COVID-19. It's not going to go away. It's not going to go away April 30th. COVID-19 is not going to go away. But what we can do is what we're doing every day. And we're here with Louisiana Department of Health and well ahead and the Bogalusa Mayor's Wellness Council and Bogalusa Strong to provide those resources, to connect you with the partners that can help provide those resources. And we can provide that education and just guidance. You can call us. You can call the hospital. You can call us. My number is 985-960-0098. And we'll gladly walk you through, like, what can I do today to make us healthier tomorrow. And I think that's what our goal is for not only City of Bogalusa, Washington Parish, but our whole state. Because unfortunately, we do rank 49th and 50th. And so we do have those high comorbidities. But we can make a change. We can make it different today. But it takes each one of us making those small changes every day. And you can do it. And it's possible. But just got to make those small choices. So I think we're going to do it. We can turn around this parish. We can turn around our city to where we have lower rates of all of those. And we're going to do it. It's possible.
Thank you so much for that. I feel ready to go at least walk 1 mile. Pastor O'Ree, can you just shed a little light on the community from a religious perspective, and any last words about how you foresee things changing from COVID-19 in our community, or any words of encouragement for the community?
Overall, I believe it have definitely helped the churches become more modernized. It helped us all go to technology if we still want to reach our congregations. In a small way, financially, it's going to be a blessing down the road, because a lot of those Mondays and Thursday meetings that they have, where you got to go crank the air conditioners up and cut them lights on all over the church. Now we got different ways to have those meetings and host those meetings. So it's going to help out a lot. But overall, I believe that the church should be a beacon of light in this world we're living in today. I believe overall the church should provide a way for people to understand what's going on and give people opportunity to understand that there is hope in the midst of this pandemic. God sent Jesus down here to walk this earth and to show us all that you can have peace in the midst of any problems you're facing. And as believers in Jesus Christ, we got to believe that today, that we can still have peace in the midst of this pandemic that we're living in. So I encourage everyone to understand that the Bible says to all of us that a man that's born of a woman is a few days, but a lot of trouble. And that trouble could be in the form of high blood pressure, diabetes, whatever the case may be. But there's a remedy for trouble, and that is Jesus Christ. So this has really forced more people to pray. It have forced more people to read their Bibles. It have forced people to click online and say, hey, let's listen to some preaching tonight. Let's look for a word tonight. It have forced people to cook more at the house. And so it's a lot of good that's coming out of this. And I thank God for all he's doing. I thank him for his protection. And I'll say this to anyone that will hear me. At the end of the day, God is in full control. And there's nothing that will happen in Bogalusa, in Russia, in Ireland. It does not matter. Nothing will happen unless he sign off on it. And that's just what we got to believe. That's what we got to stand on. It have caused us to question our faith, but it have caused a lot of people to strengthen their faith. And it should challenge all of us to at least think different, and at least to look at it from a different perspective in the midst of the pandemic that we've been up against. But God is still good. He's in full control. And I say to everyone, be encouraged and trust in the Lord. It's a good time to find him and find out what's going on. He got all the answers.
Well, thank you so much for that. And thank everyone for your time. And we'll be posting this. And if you have any questions, we'll have a few links for you to click on to ask any questions. Thank you, everyone.